Hello, everyone. Welcome to Health 180 with Carion Fenn on Rogers TV. My name is Carion Fenn. This year, the Government of Canada is recognizing the 30th anniversary of Black History Month with a theme honoring Black brilliance across generations from nation builders to tomorrow's visionary. Today, I'm joined by one of Canada's brilliant Black leaders, Donna Jones Simmons, co founder and architect of 100 Accomplished Black Canadian Women, an organization co founded with Dr. Jean Augustine, who introduced the parliamentary motion to officially recognize February as Black History Month. We want to help you learn more, so let's learn together. Ms. Donna, welcome to our show.
Thank you so much for inviting me to be here. It's just an honor and pleasure. Thank you, Karen.
We are so happy to have you here. I've been waiting for a while to interview you, so I'm truly honored.
I hope, I hope the wait is good.
Yeah. In a few words, because I know often we look at ourselves through a different lens, and I want you to tell us through your eyes, who is Donna Jones Simmons?
Ah, very difficult question because we don't like to talk about ourselves, do we? But I think I am a simple, ordinary pleb, a person who likes to work with the grassroots organizations and grassroots people who are realistic and who really see themselves as human beings. I live with integrity and humility. That's me.
That's beautiful. Black brilliance, you truly embody that, even though you don't give yourself enough credit. Uh, what does it take or mean to be Black brilliant in exhibit Black brilliance through your eyes?
I'm not sure if it's through my eyes. I think it's a case where you create something
Mhm.
and you make it bigger,
Yes.
and that can be called brilliance. And I think that's probably what a lot of our women do, Black women do, but they don't take credit. So nobody tells them that they're brilliant. But being that creative, being that architect of a project, of an initiative, for me, it spelled brilliance. Because some
Mhm.
people have not spoken or talked about it, and they've created this brilliant idea. And they need to take ownership. They need to recognize that they have the talent to do a lot of things. We don't take credit for talent at all. That's how we were taught to be humble and be simple. But for me, brilliance is about creating something that is different, that people can recognize, and really and truly see through the lens of themselves and through
Mhm.
others.
How would you describe your leadership style?
My leadership style. Ah, I get asked this question pretty often. So let
Mhm.
me just tell you in a short few words. My leadership style is I value people.
Mhm.
I respect their contributions. And I lead with fairness and integrity. I actively seek input, listen carefully, and ensure that voices are heard.
Mhm.
So I think if I put all this together, I hope I gain some respect as a leader. I believe in inclusion, and I believe that it is a practice for me to be inclusive in whatever I do. So my leadership is based on inclusion and
Mhm.
making people feel that they're valued and their contributions are important.
Beautiful said. Well, with all the things that you do, I often hear this, but I think I just don't think about it. I just do it. But how do you balance work with your personal life?
I often say work is how you perceive it.
Mhm.
I see work as a hobby, if that makes sense to you. Something I enjoy. So I integrate and I weave my personal life with my quote, quote, hobby, and it
Mhm.
becomes joy. I
Yes.
believe if you don't find joy in the things you do, you'd be unhappy. And I don't believe in being unhappy. So I enjoy what I do. I put my 150% in whatever I do so that it becomes something meaningful, not only for me, but those who receive it.
Yes. What inspires you?
My inspiration comes from the joy I receive from doing what I do, and for my children and grandchildren.
Yes.
When I became a 100 accomplished Black Canadian woman in 2024, but I brought my granddaughter Harlow to the award ceremony,
Mhm.
and for me, it was the joy of her being on that stage with me.
Yes.
To know that my grandchild was present when I was
Yes.
being acknowledged and recognized. That's the joy I get. To know that I can support women, black women, 600 of them right now, be spotlighted and recognized. And I
Yes.
don't want to take credit for it. They take credit for it themselves. That's my joy, to know
Oh,
that I can help so many people.
no, that's beautiful. I've always admired that about you in terms of, you like to be in the background and supporting other Black women, for instance, in 100 Accomplished Black Canadian Women, to allow them to shine. I've always admired, and often when I encounter someone and I'm like, okay, how can I utilize my platform to help? I often think about you and how you do things, and I admire you
Well,
in
thank you.
regards to the work
Thank
that you
you.
do there. Yeah, and I like for you to be. I was acknowledged in 2018, and for you to have 2024, I think I
I
think that
know.
says a lot about your leadership and the work that you do to support other Black women, because it's not easy. It's like, you know, we have to work like 100 times harder
Yeah.
than the average person just to be recognized in what we do, so
Yeah.
it's not easy. It's not easy. So
Well, it's nice to be recognized, I'll tell you that much.
yes.
However, it feels better when you can recognize somebody. It feels
Yes,
a
yes,
hundred times better that you know somebody's being spotlight, somebody has received a promotion,
yes,
or,
yes.
or some keynote of speaking engagement because they're 100 accomplished Black Canadian woman.
And that's what makes a great leader.
That's what
That's
makes me happy. Not about
yeah.
me being recognized. You never hear
Yeah.
me talk about it. I guess
Yes.
I get forced into it sometimes, though.
Yeah. I love it. I love it. I love it. How do you deal with failure or setbacks?
I look at it as opportunities,
Mm-hmm.
and that's the only way I can deal with it because the setbacks, sometimes, yes, they can be depressing, can be
Mm-hmm.
stressful. But I
Mm-hmm.
said, what did I learn from this?
Yes.
And if I don't learn something from it, I'm doomed to repeat it. So I
Mm-hmm.
said, you know what? I'm going to move on. But I'm going to move on with a positive attitude and say, lessons learned, noted, noted.
Yes. Yes. Yes.
You can't hold on to baggage, you know? You
Yeah.
can't hold on to baggage. It drags you down.
Yes. What um what does mentorship, or how important is membership, and how does that impact you?
When I first came to Canada, I wish I had a mentor.
Mhm.
And when I say that, my sisters were here, my brothers were here, but I went into a world that I really didn't know and was uncomfortable with. I came from the Caribbean. It
Mhm.
really nice, hot, and everything was just nice and good for me. I came to a
Yes.
country I didn't know anybody. I knew my family, yes, but in the work environment, it was a little challenging. I didn't understand the culture.
Mhm.
I wish I had a mentor who would help me through that.
Yes.
And I decided when I actually got my feet to the ground, when I felt most comfortable, I would help somebody else. And so
Mm,
today, I consider I've helped more than 100 people through my mentorship.
mhm,
And I was a chair of the board at Access Employment, and one of the things we had was speed mentoring program, and I
yes.
always volunteered to be a mentor for that program. And I learned so much from the newcomers to Canada, their
Yes.
struggles, and I say I've got to keep this going. I did
Yes.
that at the workplaces where employees were saddened, they didn't know where to go, how to go. And by just providing advice, having conversations, just listening, just simply listening, meant a
Mhm,
whole deal to them for them
yes.
to move forward.
What legacy do you hope to leave behind?
Legacy. I hope that when I pass on, you all will,
Yes.
that, um, let me see what I can say with my legacy. I hope that is one of hope,
Mhm,
commitment, that I've been seen, that I've been a fair person with integrity. I want young black Canadians to see that leadership is possible, that giving back matters, and that our community deserves to be visible, valued, and fully engaged in shaping Canada's future. Above all, I hope they see me as someone who opened doors, created a space, and ensured that our stories were not only told, but respected.
wow, that is beautiful. What's one tip you can give to someone who is aspiring to great leadership?
What advice, you said?
Yeah, what's one tip?
One tip.
Yes.
I often say never say no to a possibility. Never say no to a possibility or an opportunity. And the reason I say that is you may be throwing yourself away from something that could be great. I've
Yes.
had opportunities where I said, should I not? And I said, you know what? Let me try this.
Yes.
It may feel uncomfortable, but let me try it.
Let
And
me
I've
try.
tried it and I've been able to shape it.
Yes. That's
And we
incredible.
don't really think about that, how we can shape things
Yes.
differently, how we
Yes.
can bring different perspectives
That's it.
to
We'll
this
con-
opportunity.
we'll continue on the other side. We recognizing the 30th anniversary of Black History Month with my interview with Donna Jones Simmons, Black Brilliance, Nation Builders, co-founder of 100 Accomplished Black Canadian Women. My name is Carion Fenn. We'll be right back. Welcome back to Health 180 with Carion Fenn, Rogers TV. My name is Carion Fenn. According to the 2001 census data, 90% of Canadian born who studied medicine are working as physicians, while 55% of international educated work as doctors. Dr. Okoro is back with me to share more about healthcare in Canada versus the UK. Um, this is quite an interesting conversation because I've heard of quite a few doctors who study. Some too have seen come from like Africa, and they would go to the UK, and then they would venture into Canada.
Mm,
One of the things that I've seen that's consistent is the intensive education, the intensive experience. And I think that translates into like more excellent service and more understanding in terms of healthcare and treating patients. What do you think that type of experience, that type of education,
mm.
that type of background bring to the table in terms of healthcare and healthcare where we're at now?
Of course. So I think that given that we live in a very multicultural environment, so if you look at Toronto as a city, it's extremely multicultural. So I think the exposure having practiced medicine elsewhere can sometimes lend quite a lot of advantages because it means that you've seen so many different backgrounds, whether it's from a socioeconomic or an ethnic diversity related background. When you train, so lots of people, as you mentioned, have come from different places within Africa or the Asian continent. They have a slightly different pathway. So they're called international medical graduates, and often their qualifications, unfortunately, aren't seen the same as, let's say, a UK, a US, or a Canadian qualification. So there's a slightly different transition they need to make. Lots of the time, they have to actually apply to do residency in Canada before they can practice here. So some of them do go to the UK, as you mentioned initially, to get their training there before coming to Canada.
Oh, that's why. That's why. I've seen, like, even through our charity, I've seen so many immigrants who come to this country and they have like such intense educational background,
Mm,
and they do have to apply for positions that they far exceed the expectation, but because the
mm,
difference in the educational system is like a step back. But I think it's a loss on our society in that aspect. But it's nice to see that there's a transition in terms of I guess in doctors, because we need doctors
yeah.
for you to be able to practice here. So did moving countries to practice medicine change the type of doctor you are today?
I think that's a great question. I think that since I've been here, I've definitely learned to become more patient.
Mhm.
And I think the reason that I've become more patient is because I'm dealing with so many different patients from backgrounds that I've never encountered before. So if you think about the people from, let's say, the Caribbean, people from Latin America, people
Yes.
from Southeast Asia. There's so many different people, and often you talked about accents and people dealing with my accent. You
Yeah.
have to obviously pay attention to the different accents you hear from patients here, especially
Yeah.
in downtown Toronto. So
Yeah.
I think that sort of understanding that there's so many different healthcare needs. People are used to different healthcare systems as well. So they're used to having regular checkups or infrequent checkups or certain types of investigations done. So I
Yeah.
think that sort of trying to understand their expectations and also bringing them into awareness of how the Canadian system works has been quite an interesting challenge, but something that I've enjoyed.
It, it's nice to see that you see things like, because I know sometimes I look on TikTok and you hear the Canadian accent, and mostly they show like young people and are like, man, I'm
You
so
do.
embarrassed. Do we really sound like that?
I like the Canadian accent.
Yeah. Oh, goodness. Um, Did anything about the Canadian healthcare system surprise you?
Yeah, I think maybe not massively surprised, but I think that the things that were sort of a transition for me was understanding that things like psychotherapy, so talking therapy,
Mm,
isn't covered via the government health plan.
mm,
So lots of the times, patients who are suffering from anxiety or depression or other mental health conditions,
mm,
they often need to pay for their talking therapy, or
mm,
they need to use their, let's say, work insurance to cover those provisions.
mm.
So understanding things like physiotherapy, psychotherapy aren't covered was quite interesting for me. And also, I think that some people here complain about the waiting times of certain things like getting scans, as well as other investigations. You'll be
Mm.
surprised to hear that actually in the UK it takes longer. So,
Oh, wow.
so actually, I do understand the reservations people have about how long things take to happen because obviously, if you're waiting, sometimes your health can deteriorate in that period of time. So
Yeah.
it's really bad in some aspects, but the reality is we have a very big population and not enough doctors, so it takes time to sort of get through all the different tasks that are there to be done.
So, do you guys have a long wait time for hospitals as well, waiting room?
We
Oh,
do,
you
yeah,
do?
yeah.
Okay, okay. You know, I always used to get like community members complain to me all the time when I was a trustee, and they'd be like, we have to wait so long." And then I would have like the chief of staff, who was the chief of staff was staff to the board, but he used to say to me, you know, if it was really that serious, you'll go right through, right? Until I saw it for myself, like in this, like, you know, I know that it's a wait time,
Yeah,
but, you know, no disrespect to anyone who's sick, but when it gets that serious, yeah, you go straight through,
yeah,
right? But you have to prioritize, obviously,
1,000%.
yeah. So on the average, how many patients do you see per day here in Canada?
So it depends on doctor to doctor. So I usually work, let's say, 9.5 hour days, Monday to Friday, and I'm probably seeing anywhere between about 40 to 48 patients per day.
Mm,
So by the end, you are quite tired and exhausted from it. But there are some varieties. So most of them are face to face, but we do also do some virtual care, so some video appointments, some
mm.
telephone appointments, which helps to provide some variety.
Oh wow, that can be draining, I would
Yeah.
imagine. Is it the same amount of patients you see in one day in the UK, or is there a difference between?
I
Uh,
saw slightly less in the UK, so not by much, but I probably saw on average probably between 38 to 40.
yeah.
But the system's slightly different here in that we accept walk-ins, whereas in the UK, the whole concept of having a walk-in clinic, it's not very common in the UK compared to how it is over here. So
Mhm.
sometimes you have a day that's sort of packed out, and then you actually have walk-ins on top. And we have a policy at Adelaide Medical Clinic of not turning away walk-ins.
Mhm.
So sometimes your day can be very, very busy.
It's very impressive to see that you've been here for 15 months and you've not only in the healthcare field, but you are a business owner.
Mhm.
What does that feel like? That's a big accomplishment. There are doctors here who been practicing and not necessarily have their own practice.
Yeah.
What is that like?
I think that it's been a tough transition. I think that nothing in life, as the cliche goes, nothing in life worth having comes easy.
Mm,
But I'd always sort of set my sights on trying to have a clinic that I could be proud of.
mm,
And the sort of difficult thing that I found is delegating, because I think that when you first start something, you're always checking your emails, you're always trying to think about how you can make things better. But actually, the real power comes in having a team of people that you can trust in. So, yes, it's been a very quick transition, but an opportunity came to me that I thought, yes, I can actually do this and improve the local community by having a service that I'm proud of and caters to them. So if I think about the fact that I've come here and made that transition, yes, it sounds like a crazy journey. But over the past few weeks, it's all made sense and it's all fallen into place.
Mm-hmm. So how can someone book an appointment with your clinic?
Yeah. So all they would need to do is to go on adelaidemedicalclinic.ca on the website, and they could register as a new patient and book an appointment that way.
Mm-hmm.
So that's the most common way that people would obviously book an appointment. But often we do get walk-ins as well. So they would come to the clinic, which is on 400 Adelaide Street East, and they could obviously come in for a walk-in appointment.
Yes. I have to ask you this. This is one of my, well, two of my best words when it comes to the medical. Um, what I want to know, what's your view of best health? Because often we tell people, or
Mhm.
we put it up on people, individuals, to have a standard of health that is far greater than what they could reach. What is your interpretation of best health?
So my interpretation of best health would be empowering yourself. So the key for me is that as doctors, yes, we do have a position of privilege in that people look at us as sort of gatekeepers that can give advice, provide investigations, provide medication, and treat conditions. But actually, this only serves as a minority percentage of your overall health. In order to have your best health, the key things are to be consistent, whether it's with your diet, your exercise, your mental well-being, all those sort of holistic factors of life, I think amalgamate together to provide your own best health.
What is one tip you could give to a doctor transitioning to practicing medicine in Canada from the UK?
I would say that my doors are open, so I'm always happy to provide advice personally. But jokes aside, I think that the key thing for me is to do research.
Mhm.
So it is quite easy to come over here and to be in some aspects in a setting that's not right for you. So I think that understanding what is the local community like, what is the clinic like, what are the clinic owners like, what are my colleagues going to be like, is there an opportunity for me to come and shadow before I sign a contract? All these things are really key because you don't want to make a massive transition and then find you're in a situation that you're not happy in. So I think that doing your research is everything.
Yes, and that is actually good advice. That's all the time we have for today's episode of Health 180 with Carion Fenn on Rogers TV. My name is Carion Fenn. Thank you to Dr. Francis for joining us from Adelaide Medical Clinic, and thank you for joining me. And remember, together we are stronger.